10 warning signs of vitamin B12 deficiency. Vitamin B12 is like a superhero for your body. It keeps your nerves protected, helps make your blood, and even plays a part in how your brain works. Despite its crucial role, many of us might not get enough of it. Especially if you're a vegetarian, over 50, or have stomach issues, it may make absorbing B12 harder. In fact, up to 20% of people over the age of 60 in the United States and the United Kingdom are deficient in vitamin B12. But what happens when you run low on this vitamin? In today's video, we will explain the 10 symptoms of vitamin B12 deficiency that you need to be aware of to protect your health. Also, stick to the end of the video, where we will highlight a few foods that will help you maintain an optimum balance of vitamin B12 in our bodies. Let's start. 1. Fatigue. People with vitamin B12 deficiency often face fatigue because B12 is crucial for the production of red blood cells, which are responsible for transporting oxygen throughout the body. When there's a shortage of B12, the body struggles to produce an adequate number of normal red blood cells. Moreover, the red blood cells that are produced tend to be larger and irregularly shaped, a condition known as megaloblastic anemia. These abnormal cells are less efficient at moving oxygen, which means that even though your lungs might be working fine, the rest of your body isn't getting the oxygen it needs to convert glucose into energy effectively. This insufficient oxygen transport may leave you feeling constantly tired no matter how much you rest. It's not just normal tiredness, but a deep, draining fatigue that may impact your daily activities and overall quality of life. Your muscles and brain don't get enough oxygen to perform well, which may make you feel weak and sluggish. This kind of fatigue isn't something that may be fixed with a good night's sleep. It's a persistent feeling of exhaustion that might only resolve with a proper diagnosis and treatment of the B12 deficiency. 2. Pale or jaundiced skin. People with vitamin B12 deficiency often develop pale or jaundiced skin due to a type of anemia called megaloblastic anemia, where the body produces large, immature red blood cells that cannot function properly. Normally, red blood cells are responsible for carrying oxygen to tissues, giving skin a healthy, rosy color. However, in B12 deficiency, the ineffective, abnormal red blood cells mean less oxygen reaches the body's tissues, including the skin, leading to a pale appearance. Furthermore, as these oversized, poorly functioning red blood cells break down faster than healthy ones, they release bilirubin, a yellow pigment that is a byproduct of the breakdown of old red blood cells. Normally, the liver processes bilirubin and it's expelled from the body. But when red blood cells break down too quickly, the liver can't keep up, causing bilirubin to build up in the blood, leading to a yellowish tinge to the skin and whites of the eyes, which is known as jaundice. This pale or jaundiced skin is more than just a cosmetic problem. It is a sign that vitamin B12 deficiency, which is essential for the creation of functional red blood cells, is having an impact on deeper bodily functions. Without adequate B12, oxygen transport is compromised, which may impact overall health beyond just skin appearance. 3. Headache. While headaches aren't one of the most common symptoms directly attributed to vitamin B12 deficiency, they may occur in some individuals. The lack of adequate B12 impairs the body's ability to produce healthy red blood cells, leading to anemia. This form of anemia, characterized by larger and more inefficient red blood cells, may result in less oxygen being transported to various parts of the body, including the brain. When the brain doesn't receive enough oxygen, it may lead to feelings of lightheadedness and result in headaches. Additionally, vitamin B12 plays a critical role in nerve health by aiding in the production of the myelin sheath, a protective covering that ensures the proper functioning of the nervous system. Without enough B12, myelin is produced defectively, which may disrupt normal nerve signal transmissions. This disruption may manifest as neurological symptoms, including headaches, as the nerves related to brain function may not perform optimally. Moreover, B12 is involved in the metabolic pathway that synthesizes and regulates neurotransmitters like serotonin and dopamine. An imbalance in these chemicals due to B12 deficiency may also potentially lead to headaches, as these neurotransmitters are crucial in the modulation of pain and mood. A study with 140 people found that blood levels of B12 were significantly lower in the participants with migraine. Those with the highest B12 levels were 80% less likely to have migraines compared with participants with the lowest B12 levels. 4. Nerve damage. People with vitamin B12 deficiency may face nerve damage due to the crucial role B12 plays in maintaining the health of the nervous system. Vitamin B12 is essential for the production of myelin, the protective sheath that surrounds nerves and facilitates efficient signal transmission between different parts of the body and the brain. Without sufficient B12, myelin is not properly formed, and this may lead to what is called demyelination, where the existing myelin sheath deteriorates. Without a functional myelin sheath, nerves cannot conduct signals properly, which may lead to a range of neurological problems. Many adults and kids who have B12 deficiency report experiencing paresthesia, a burning or pins and needles sensation in certain areas of the body like the hands and feet. This occurs because peripheral nerves, those outside the brain and spinal cord, are often the first to have impaired function due to their lack of adequate myelin protection. Over time, if the deficiency is not corrected, this damage may progress, leading to decreased coordination and balance, muscle weakness, and even alterations in the way you walk. The nerve damage resulting from B12 deficiency is primarily due to its effect on nerve conduction and health. It's not just about the nerves feeling wrong, it may also affect how signals are sent for muscle movements and how sensations are transmitted back to the brain. Essentially, the entire communication system in your body may start to malfunction. This may be particularly serious because once significant nerve damage has occurred, even after correcting the vitamin B12 deficiency, some of the damage might be irreversible. 5. Breathlessness and dizziness. People with vitamin B12 deficiency may experience dizziness due to the impact of this deficiency on the body's oxygen transport capabilities and blood circulation. Vitamin B12 is essential for the production of red blood cells, which are responsible for carrying oxygen from the lungs to various parts of the body. When B12 levels are low, the production of these cells is compromised, leading to a condition known as megaloblastic anemia. In this type of anemia, the red blood cells are larger than normal and fewer in number, which affects their ability to carry oxygen efficiently. With inadequate oxygen being transported around the body, tissues, including those in the brain, don't receive the oxygen they need to function properly. This oxygen deficiency may cause symptoms like lightheadedness and dizziness. The sensation of dizziness often arises because the brain, which is highly sensitive to decreases in oxygen, is not functioning optimally. This may make it hard to maintain balance and coordination, contributing to a feeling of being unsteady or lightheaded. In a study with 38 patients, 4 experienced dizziness due to B12 deficiency. All patients with neurological symptoms of vitamin B12 deficiency recovered within 1 month after vitamin B12 supplementation. 6. Vision problems. B12 deficiency may cause vision disturbances, possibly due to damage to the optic nerve. Vitamin B12 is crucial for maintaining the health of nerves because it is vital in the production of myelin, the protective coating that surrounds nerves and helps them transmit signals efficiently. When B12 levels are insufficient, myelin is not properly formed, which may lead to nerve damage. This condition, known as optic neuropathy, involves damage to the optic nerve, which connects the eye to the brain. When the optic nerve is affected, it may disrupt the transmission of visual information from the eyes to the brain. This disruption may manifest as blurred vision, double vision, or loss of vision. People might notice that their vision becomes fuzzy, or they might have trouble focusing on objects. In severe cases, the nerve damage may lead to significant and potentially permanent vision loss if the deficiency is not corrected in time. 7. Mood changes. People with vitamin B12 deficiency may experience significant mood changes due to the nutrient's critical role in brain function. Vitamin B12 is essential for the synthesis of neurotransmitters such as dopamine and serotonin, which are crucial chemicals in the brain responsible for regulating mood. A deficiency in B12 disrupts the production of these neurotransmitters, leading to imbalances that may manifest as mood swings, depression, or irritability. Additionally, B12 plays a pivotal role in the metabolism of homocysteine, an amino acid in the blood. Elevated levels of homocysteine, which occur when B12 levels are low, have been linked to various psychiatric disorders, including depression and bipolar disorder. High homocysteine levels are thought to contribute to brain inflammation and oxidative stress, which adversely affect brain health and mood stability. Moreover, B12 deficiency may cause neurological changes, including nerve damage and impaired nerve signal transmission, which may further influence cognitive functions and emotional regulation. Individuals experiencing these mood disturbances may not immediately connect their emotional symptoms with a possible nutrient deficiency, making B12-related mood changes particularly insidious. A study with 132 children and teens found that the participants with depression had lower B12 levels and higher levels of homocysteine compared with those without depression. 8. Oral health issues. People with vitamin B12 deficiency may face a variety of oral health issues, primarily because B12 is crucial for cell reproduction and proper tissue healing and maintenance, which are vital for healthy mouth and gum tissues. One of the most common oral symptoms of B12 deficiency is glossitis, a condition characterized by a swollen, inflamed, and often shiny tongue. This happens because the deficiency leads to a reduction in the production of mature epithelial cells in the mucous membranes, including those of the tongue, making it appear smooth and tender. This may make eating and speaking uncomfortable and may alter taste sensations. In addition to glossitis, B12 deficiency may cause mouth ulcers or sores. The lack of B12 disrupts the normal regeneration of cells lining the mouth, making it more susceptible to breaks and ulcers. These ulcers may be painful and may also increase the risk of infections in the mouth due to impaired healing processes. 9. Difficulty walking. A B12 deficiency may result in ataxia, which is a neurological symptom of impaired balance and coordination. As such, a person with B12 deficiency may have difficulty walking and balancing. It may be due to the impact of the deficiency on the nervous system, particularly the spinal cord. Vitamin B12 is crucial for maintaining the health of the myelin sheath, the protective coating that surrounds nerve fibers. This myelin sheath ensures that electrical impulses travel efficiently along nerve cells, including those that control muscle movements necessary for walking. When B12 levels are low, the production of myelin is compromised, leading to a condition known as subacute combined degeneration of the spinal cord. This degeneration primarily affects the nerves in the spinal cord that are responsible for sensory and motor function. Without a fully functional myelin sheath, these nerves cannot effectively transmit signals from the brain to the legs and feet. This disruption in communication may result in a variety of symptoms, including reduced coordination and balance, muscle weakness, and an abnormal gait, all of which make walking difficult. 10. Memory loss. People with vitamin B12 deficiency may experience cognitive issues due to the critical role that B12 plays in brain health and function. Vitamin B12 is essential for maintaining the integrity of the nervous system, including the brain, by aiding in the production of myelin. Inadequate myelin may disrupt normal brain communication, slowing down or confusing signal transmission between different parts of the brain. This may manifest as difficulty processing information, slower thinking, and problems with concentration. Additionally, vitamin B12 is involved in the metabolism of homocysteine, an amino acid that, at high levels, is associated with brain degeneration and the development of dementia. Elevated homocysteine levels may damage brain tissue and contribute to cognitive decline. People with B12 deficiency often have higher levels of homocysteine, which increases their risk for cognitive issues. The cognitive issues associated with B12 deficiency are particularly concerning because they may resemble those seen in dementia and Alzheimer's disease, especially in elderly individuals. Symptoms such as memory loss, confusion, and changes in thinking may significantly affect a person's daily functioning and quality of life. For example, a study involving 202 people with mild mental impairment and low or low normal B12 levels and elevated homocysteine levels offered B12 replacement therapy for 3 months. After the treatment, 84% of the participants reported significant improvements in symptoms like poor focus, memory decline, and forgetfulness. Now let's discuss 7 foods you should eat to maintain optimal B12 level. Do you feel any of the symptoms mentioned earlier? Do you feel tense? But we want to assure you that you can maintain your vitamin B12 level by just adding the right foods to your diet. Beef. Beef is an excellent source of vitamin B12, providing a significant amount per serving, especially in the liver, which is among the richest sources. Beef not only helps boost B12 levels, but also provides other vital nutrients like protein, zinc, and iron. Including lean cuts of beef in your diet may help maintain healthy B12 levels, supporting nerve health and red blood cell formation. Clams. Clams pack a powerful punch of vitamin B12, making them one of the best seafood options for increasing intake of this essential nutrient. They are also low in fat and high in protein. Clams are often served in chowders or as appetizers, but incorporating them into your regular diet may significantly boost your B12 levels, along with providing other beneficial minerals like iron and potassium. Fortified cereals. For vegetarians or those who prefer not to eat meat, fortified cereals are an excellent alternative to meet vitamin B12 needs. These cereals are enriched with various vitamins and minerals, including B12. Starting your day with a serving of fortified cereal may help ensure adequate intake of B12, promoting healthy blood and nerve cells. Eggs. Eggs are a versatile and readily available source of vitamin B12, particularly in the yolks. They are also a good source of protein and other essential nutrients, like choline, which is important for the brain. Incorporating eggs into your diet through various dishes may help maintain adequate B12 levels and support overall health. Milk and dairy products. Milk and dairy products like cheese and yogurt are good sources of vitamin B12, making them important for vegetarians who consume dairy. They also provide calcium, which is beneficial for bone health. Regular consumption of dairy products may help prevent B12 deficiency and support the health of the nervous system and blood cells. Each of these symptoms may significantly impact quality of life and warrant attention for potential B12 deficiency, especially in populations at risk, such as vegetarians, elderly individuals, and those with gastrointestinal disorders, which may impair nutrient absorption. Prompt diagnosis and treatment may alleviate symptoms and prevent long-term health complications. Always consult healthcare providers for a definitive diagnosis and appropriate management of vitamin B12 deficiency. Today we learned about all the symptoms that you may experience when you are low in vitamin B12. But did you know that there are other signs that your health might be at risk? Want to find out more? Watch 11 alarming signs your body needs more zinc. Or watch 10 warning signs of bowel cancer you should not ignore. You may watch either or both of them. Do you know any other symptoms of vitamin B12 deficiency that were not mentioned earlier? Let us know in the comments section below.